Hey everybody, this is Dr. Daniel Amen. We are coming to the end of another week of the pandemic. I am thinking about you, and I know that this is hard for so many people. I know some of you, especially the introverts among you, are finding this glorious because you don't have to be around other people and you actually get energy from being alone. The extroverts, they're out protesting on Huntington Beach Pier today. There's a lot of strife and conflict, and I'm very concerned about people just staying inside. I mean, I drive down Pacific Coast Highway and there's a big flashing sign that says, stay home. The problem, as vitamin D levels go low, people are actually more vulnerable to get sick. And I'm going to talk about the big lesson from 160,000 scans. That's the theme for tonight, and it's really important. But another thing I've just been thinking about all day, you know, as much as you like the government and Dr. Birx, you know, Dr. Birx and I actually trained at the Walter Reed Army Medical Center at the same time. So she was in infectious disease, I was in psychiatry. So if I knew then what I know now, our paths would have crossed a lot, because infectious disease is a major cause of psychiatric disorders and nobody knows about it. And so I'm a fan of hers. But what I'm really irritated about today is we're spending trillions of dollars. We're making people stay at home. We're damaging lives. And nobody's talking about the big issue. Why are there more deaths in the United States than anywhere in the world, even though we don't have the populations of China? I know you can't really trust what's coming out of China. We don't have the population of India, that Japan has 126 million people and less than 1,000 deaths. So why are we at 65,000 deaths? And, you know, one of my favorite verses in the New Testament is John 8:32. Know the truth, and the truth will set you free. The COVID-19 is attacking us because as a society, we are sick. As a society, we have damaged immune systems because of the standard American diet, because the dermatologists won, they made us afraid of the sun, and as a society, we have dramatically lower levels of vitamin D. Kids aren't outside playing, they're inside playing video games. So 50% of the population is diabetic or pre-diabetic, which is a risk factor for mortality in COVID-19. It's also a risk factor for depression. As a society, 72% of us are overweight, 40% of us are obese. It's the biggest brain drain in the history of the United States. I published 2 studies. I have 2 more coming out. As your weight goes up, the size and function of your brain goes down, plus the fat on your body produces something called inflammatory cytokines, which is inflammation. And we know what happens in COVID-19 is people get pneumonia, they get an immune response, the inflammation can cause something called a cytokine storm. And if you're already inflamed, your chances of surviving that storm are just a lot less. In addition, 60% of the population is hypertensive or pre-hypertensive. If we don't get healthy as a society, if we just put the effort into getting serious and healthy as a society, this is just a better use of our resources. All right, enough for the rant. I want to talk about the most important lesson, because I promised last night I would. So I was an infantry medic, and that's where my love of medicine was born. So 1972, I turned 18. The government still had a draft. I had a really low draft number, so it's from 1 to 365. So they do this raffle lottery, and I guess they were drawing ping pong balls out of some big container. And July 19th, it's my birthday, came up as 19. So 1 is the worst you can get, 365 is the best you can get, 19 meant bye, see you later. So I became an infantry medic, and I just fell in love with medicine. But about a year or so into it, I realized 2 important things about myself. I didn't like being shot at. It's just not me. There's some people, they sort of like it. It wasn't me. And I didn't like it. I'm like, the bullets are hot. They can rip off your shoulder. And I was a really good marksman, but killing people, just not me. And I also didn't like sleeping in the mud. I'm not a big camper. That my wife, she likes to go, and she'll go up by Santa Barbara and go glamping. And I'm like, but there's a Four Seasons there. Really? Why would you sleep in a tent? There's bugs. So anyways, it's just not me. And so I got myself retrained as an X-ray technician and developed a passion for medical imaging. As our professors used to say, how do you know unless you look? And where I was stationed in Germany, I had my own X-ray department in the dispensary on the weekends. I go to Heidelberg and take pictures of the cool castle there, and I could develop them and the chemicals in my X-ray department. But I loved taking pictures of bones and lungs and hips and spleens and all the things I got to take pictures of, skulls. And when I got out of the Army in 1975 and sort of went, I wonder if I could go to medical school, because I never thought I was that smart. And but I worked really hard, and I went to medical school at Oral Roberts University in Tulsa, Oklahoma. And when I'm a second-year medical student, someone I loved tried to kill herself. And I took her horrified. Like, I'd never dealt with anybody who had suicidal behavior before. And I took her to see a wonderful psychiatrist, and I came to realize if he helped her, which he did, it wouldn't just help her, that ultimately it would help her children and even her grandchildren, is they would be shaped by someone who was happier and more stable. So in 1979, I fell in love with psychiatry because I realized it has the potential to change generations of people. And I have loved it every day for the last 41 years. But I fell in love with the only medical specialty that never looks at the organ it treats. And back then, I knew it was wrong, and I knew it would change. That the brain is the organ of mental health. And I started agitating my professors. It's like, well, why don't you look? How do you know? Unless you look, this person's psychotic. Don't you think that's a brain? And they basically said what Freud said in 1895 which is the brain science of my time, is not up to the task of explaining patient symptoms. So they said, oh, it's just for research, it's not clinically practical, but I didn't buy it. Growing up, my dad called me a maverick, and to him that was not a good thing. So I started poking and agitating my colleagues. And then after I graduated from ORU, I went to Walter Reed in 1982, my psychiatric internship and residency there. And I'm like, why aren't we looking? And they're like, oh, it's not ready. But it's the future. And brain SPECT imaging was actually starting to be done in the early 1980s. SPECT is like PET. They're nuclear medicine studies that look at blood flow and activity. That's what SPECT does. PET looks at glucose metabolism. But we actually get to look at living tissue. And so I agitate them, and they're like, not ready. And then I go off to Hawaii, to the University of Hawaii and Tripler Army Medical Center, where I did my child and adolescent psychiatry training. Dearly love Hawaii. It's a whole nother story. And then when I finished my training, the Army, and if it's infinite wisdom, sent me to a place called Fort Irwin, which is in the middle of the Mojave Desert. It's 40 miles due north of Barstow. So any of you who've been to Barstow, I lived there for a couple of years, but in this little tiny Army post, that's where we train the U.S. Army to fight, at the time, fight the Russians in the desert. Now it's, Iraqis and Afghanis and ISIS and so on. And the National Training Center, I'm the only psychiatrist for about 10,000 people. And I'm the chief of everything: drug and alcohol, domestic violence, mental health, and quite frankly, I loved it. It's like my first real job out of training. And it's there I learned about biofeedback, something called neurofeedback, where we could put electrodes on people's scalps, measure electrical activity in the brain, and then teach people to change it. And that's what the seed of the idea of you're not stuck with the brain you have. You can make it better. I can prove it. And so from there, I learned a technique called quantitative EEG. And now we're seriously looking at brain function. And I'm not the only one. I actually went to a course at Harvard given by neurologist Frank Duffy on how to do quantitative EEG for psychiatric patients. And I'm just like a little kid. 1989, I got out of the Army and opened the first Amen clinics in Northern California and started doing quantitative EEG on my patients. And then in 1991, I went to a lecture on brain SPECT imaging. Again, SPECT looks at blood flow and activity, looks at how your brain works. The chief of medicine, Jack Paldy, at the hospital near where I worked, gave a lecture at Grand Rounds, and he said, this is a tool to give psychiatrists more information to help their patients. And because of my interest already in looking at the brain, that one lecture changed the rest of my life. No lie. I went out of that lecture and went into a patient's room. Her name was Sandy. And I knew she had ADD, but she wouldn't admit it and wouldn't take treatment for it. I'm like, well, can I scan your brain? I said, we have this new tool. And I knew I should do it twice. Once at rest, once when she concentrated. Because what we knew about ADD from the research, it wasn't a disorder of a resting brain. People with ADD can rest just fine. It was a disorder of trying to get them to do something. like their homework or their paperwork or chores. And after the scans came back a couple of days later, I put them on the table in the hospital room. And as what we saw was the classic pattern for ADD is healthy brain at rest. And when she tried to concentrate, the front part dropped in activity. What does that mean? It meant the harder she tried, the worse it got. And as I explained it to her, she started to cry. And she said, "You mean it's not my fault?" That is such an important moment. And I said, no, I said, having ADD is sort of like people who need glasses. And I wear glasses to drive, and I took my glasses out and put them on. I said, people who wear glasses aren't dumb, crazy, or stupid. Our eyeballs are shaped funny. And we wear glasses to focus. People have ADD. They're not dumb, crazy, or stupid. In fact, they're often really bright, but they can't focus. And we stimulate their frontal lobes so they can focus. And she took the treatment, got dramatically better. And I'm like, there's something to this imaging. But no lie, the next 10 cases radically changed my life. I mean, the next one was a woman who was diagnosed with Alzheimer's disease. She almost burned her house down. Her 5 daughters were going to put her in a board and care facility, and she didn't want to go. And they said, well, let's just put her in the hospital one more time, get a really good workup, and by random chance, if you believe in random chance, I was on call when she came in, and I thought she had Alzheimer's disease too. And in 1991, the pattern for Alzheimer's disease had already been described in the medical literature. It's bilateral, it means both sides, low activity in the parietal lobes, top back part of the brain. I have no hair, so you can almost see mine. And the temporal lobes underneath your temples and behind your eyes. But she didn't have that. She had a beautiful brain, but her emotional brain was all stirred up. She had something called pseudo dementia, which means she's really depressed. But it showed up as if she had Alzheimer's disease. And did you know the research since then is that we can tell about 20 years before you have any symptoms if you're headed to the dark place, if your brain is headed to the dark place. And so on a medicine for depression, Wellbutrin, within 3 weeks, she's a normal person. She's leading cooking groups on the hospital ward. She's happy. Her memory's fine. And when I discharged her, I had never had the experience like that of gratitude from a patient or from a patient's family. And how would I know unless I looked? And then I had a 12-year-old boy, Chris, who had attacked a little boy at school, actually took a pencil and put it in his neck. And this was his 3rd psychiatric hospitalization for aggression. And he was mean. And when I scanned him, he had low activity in his left temporal lobe. And I had no idea what that meant, so I went to the hospital library, you had to do that then, and looked up SPECT and low activity in the temporal lobes, and they go, oh, it's similar to seizure activity. And on an anti-seizure medication, Tegretol at the time, he became just one of the sweetest kids. And so here, change someone's compliance with ADD, change someone's life, literally, by taking them out of the dark place, if you remember the movie Awakening, sort of like that. And then a child who's clearly headed for a lot of trouble. I just got hooked on imaging. And I have come to believe, how the heck do I really know what's going on with you unless I look? If I don't look, I don't really know. And why would I start putting you on powerful medications if I have no idea what's going on in your brain? So some of the big lessons from imaging is how we diagnose people is just wrong. It's a bad paradigm. So for example, this is how psychiatrists typically diagnose people. They use this big book, they call it the Bible of Psychiatry. And so I'm speaking heresy and have plenty of people tell you I'm a heretic. But if you have 5 of these 8 symptoms, they give you a diagnosis of depression. So you basically go, I'm depressed. They give you a diagnosis with the same name of what you just told them. Oh, you're depressed. And then they give you antidepressants, which in large-scale studies work no better than placebo. Now, I target the right medicine to the right brain. They work way better than placebo. But depression's not one thing. It's probably a dozen things. Or you come to them and you go, I'm anxious. And they'll go, oh, well, you have an anxiety disorder diagnosis. And then they give you a medicine that we now know is both addictive and increases your risk of dementia later in life. Those are called benzos, like Xanax or Klonopin, Ativan, Valium. I'm just not a fan, by and large, of those medicines. Or you go, I can't concentrate. And they go, well, you have ADD. And then they give you a stimulant without going, well, what kind of ADD do you have? Is it from a head injury? Is it from toxic exposure? Did you inherit it? Or my favorite diagnosis to help explain this insanity is you have temper problems. And so you tell the doctor, or your mother tells the doctor, or your wife tells the doctor, you explode intermittently. You periodically explode. Do you know there's actually a diagnostic category called intermittent explosive disorder? So what the heck does that mean? It means you explode intermittently. Really? And the acronym IED, sort of like improvised explosive device, it's just ironic. Now, in my experience, it's usually due to a head injury that affects the left or the left and right temporal lobes. But this is our diagnostic system, and it's insane because it's not based on any underlying neuroscience. So it'll tell you what it is. It will not tell you what causes it or what's the right thing to do to fix it. And right away, that's what the imaging taught me, is I was taught an outdated system. And I was taught, well, I'm a double board certified psychiatrist. I passed all the tests, did all the things I was supposed to do. The second lesson is psychiatric disorders are not single or simple disorders. They all have multiple types. Autism isn't one thing. ADD is not one thing. I wrote a book called Healing that sold about 500,000 copies. Like, it's 7 different things. Stop giving everybody Ritalin because, it works like a miracle for some people, and it's a freaking nightmare for other people. The third lesson was looking decreases stigma, increases compliance, and completely changes the discussion around mental health. That's why I wrote my book, The End of Mental Illness. I hate the term mental illness. It's wrong. There are brain health issues that steal your mind. It's stigmatizing. It's shaming. And it causes people not to want to get help because no one wants a mental illness, but everybody wants a better brain. The next lesson I learned, if what you're doing is not working, somebody should look at your brain. that it's just so important. I had this one boy who'd seen 6 psychiatrists, had been in residential treatment and failed, had been in a drug treatment program and failed, and it turned out he had a cyst the size of a tennis ball occupying the space of his frontal and temporal lobe. Now, do you really think psychotherapy is going to fix that? Do you really think medication is going to fix that? No, we had to drain the cyst and then work really hard to rehabilitate his brain. Brain completely changes the discussion about good and evil. Easy to call people bad. It's a lot harder to go, why? Why did you do that thing? I have scanned about 1,000 convicted felons, over 100 murderers. I published a study on our group of murderers, overall really low function in the front part of the brain. Now, does that mean they didn't do it? Nope. Does that mean they're not responsible for it? Nope. But when you judge them, you need to consider the biological underpinnings of perhaps why they did what they did. And I've testified in a number of death penalty cases. Looking at the brain helps to prevent mistakes. You're really not going to manage that person's brain that's really damaged. The next lesson we learned is mild traumatic brain injury ruins people's lives. And nobody knows about it because they end up seeing psychiatrists that never look at the brain and they don't realize, oh, you damaged the left front side of your brain. One of my favorite patients, wealthy, good looking, has everything, except just one morning woke up with panic attacks and then went on Xanax and he got worse. And then went on an antidepressant, and now he has suicidal ideation. He'd never felt suicidal before. And when he came to me, I'm like, so when did you have a brain injury? And you could just see it in his scan. And he's like, I never had a brain injury. I said, you did. I mean, maybe you don't remember, but did you ever fall out of a tree, off a fence, dive into a shallow pool? He's like, 2 weeks before my first panic attack, I had a bike accident in the Santa Monica Mountains, and I cracked my helmet. I didn't lose consciousness, but I was clearly not right for a couple of days. Repairing his brain repaired his life. Repairing his brain repaired his life. Now, how would I have known that if I didn't look? Seriously? Another lesson is, most people know drugs and alcohol are bad for your brain. I mean, not everybody, right? Marijuana is rampantly legal now, and I'm actually a fan of making it legal, and yes, I think it has some medicinal uses. But I'm not a fan of rampant use because it prematurely ages your brain. It just does. And is it worse than alcohol? No, they're both bad. But then I learned there are all sorts of other things that cause psychiatric problems, like mold exposure or anesthesia. One of my assistant at Amen Clinics, I have her brain, big and fat and beautiful. And it's the only part of you, I guess, you want to be fat. Big, fat, and beautiful. And she was just really great. And then she had an aortic aneurysm that had to be repaired. She had an 8-hour surgery. And I could tell afterwards, she's just different. She's sad. And she's not as on top of things as she was before. And so when we scanned her, the anesthesia had clearly damaged her brain, which is more common in long heart procedures. And so we went to rehabilitate her brain, and then a couple of months later, her brain is better. But nobody tells you when you're going to do general anesthesia that that may, in fact, be an assault to your brain. And then as a psychiatrist, I learned about things like heavy metal exposure, carbon monoxide. Virtually all of the firefighter brains I see are toxic. So SPECT has taught me so many important lessons. I mean, it's so much a part of my life that when I met Tana, my wife, 15 years ago, I'd been married for 20 years, and I told myself if I ever got married again, one of the first parts of her I wanted to see was her brain. And Tana is a neurosurgical ICU nurse, and so we sort of bonded over our love for the brain. And so about 2.5 weeks after I met her, I'm like, you haven't seen the clinic. Don't you want to see the clinic? And so she came and I scanned her, and she had a beautiful brain, so I could fall in love with her, which I did. And still am. And I'm so grateful that in a pandemic, we get along so well. And quite frankly, if you date any of my children, I have 4 children, and all of the people they're with have been scanned. And I'm not kidding. I want to know. Sort of like Meet the Parents. You remember Ben Stiller's character and Robert De Niro's character. They're in the basement, and he's doing a lie detector test. It's, I just want to know, is it healthy? And if it's not, you can stay. You just have to agree to take care of your brain. And my 16-year-old daughter's boyfriend, we scanned him, and it really made a significant positive difference for him. Okay, so here we are. The most important lesson from 160,000 scans. It's fun. I actually remember I gave this lecture, the most important lesson from 16,000 scans, which was a long time ago. I think it was like 20 years ago. You're not stuck with the brain you have. You can make it better. I can prove it. I've done thousands of before and after scans. I did a study on NFL players. We've scanned and treated over 300 players, and 80% of our players, if they do what we ask them to do, just in as little as 2 months, their brains are better. We've scanned firefighters who have better brains. We've scanned police officers. We've scanned soldiers. We've scanned children, adults. If you've been bad to your brain and you get serious about making it better, it'll dramatically change the trajectory of your life. From the introduction of The End of Mental Illness, I have this case, and I actually have the scans. So Chase was a smart, successful young man, fresh out of college with a great job. But inside he was suffering. Chase struggled with severe anxiety, uncontrollable mood swings, negative thought patterns, crippling panic attacks, a bad temper, and disrupted sleep. He had difficulty with work relationships and making friends. He couldn't talk to people and always seemed to be in a bad mood. He also lacked a clear sense of any purpose. As a teenager, he saw a psychiatrist who asked him to fill out a questionnaire, diagnosed Chase with bipolar disorder without ever looking at his brain. Also diagnosed him with ADHD and intermittent explosive disorder. Chase had a family history of depression and addictions. Over the years, He jumped from one medication to the next, trying to find what worked. The side effects only made him worse, and he gained more than 80 pounds. This young man, who already had social anxiety, now had even more reasons to isolate himself. Chase's brain and body finally gave up. He had a nervous breakdown and was unable to go to work. Chase's stepmom, Terry, who actually worked with me, suggested that he come to our clinic in New York for an evaluation. Terry's daughter had struggled with learning and anxiety attacks, but had dramatic turnaround after coming to the. That inspired Terry, and subsequently we scanned her. She had a really toxic brain, and it was better, which made her a better leader. As we do with all of our patients, we took a really detailed history on Chase, so we just don't do scans. We took a detailed history, did neuropsych testing, did a lab workup. Chase had low vitamin D. So imagine now he's overweight, low vitamin D. If he gets hit with the virus, bad news. And he had low testosterone, even though he's really young. His scans were pretty terrible. I'll just show you from the book. He had really low blood flow. So this is the first one, really low blood flow. This was his follow-up one, so this story has a good ending. After seeing his scans and understanding the story of Chase's life, it was clear he did not have bipolar disorder, ADHD, and IED, but rather the long-term effects of concussions and toxic exposure from gasoline fumes. So it turned out his family owned a NASCAR speedway. And Chase had been racing cars since he was a child, spending a lot of time around and breathing in toxic gasoline fumes. He had had a number of significant concussions, including one from racing. Many people are misdiagnosed with bipolar disorder after they've had significant concussions that affect their frontal and temporal lobes. So what did we do? We stopped his medication, gave him brain supportive supplements, and went to work rehabilitating his brain using the approach we use at Amen Clinics. We all call it our four-circle approach. Strengthen his brain, his biology, go after strengthening his mind, teach him to kill the ants, help him with social connections and meaning and purpose. So changed his diet, gave him supplements. Ultimately, we also did hyperbaric oxygen. And in just a few months, his confidence soared. Several months later, his brain showed improvement, and he had lost 80 pounds. So look, Chase before, Chase afterwards. Before, afterwards. After learning about his brain, Chase still loves watching racing, but said he'll personally never race again. And not just because of concussions, but also the toxins he was inhaling, gas, oil, burned rubber, and all the other chemicals. So did he have all this alphabet soup of psychiatric illness, or did he have a brain that was in trouble? Come on, we need to do better. And if you don't look, you don't know. But looking changes everything. And I love his story because you are not stuck with the brain you have. You can make it better. And with a better brain, always comes a better life. I'm Dr. Daniel Amen. Have a great night.